Bruning, and I am the current chair of the Advocacy Council for the American Alliance of Orthopedic Executives. And today I just wanted to talk very briefly about the NIH grant and research funding cuts and freeze that have been occurring recently and how those affect healthcare in general. The NIH funding cuts and freeze reduce the spend on indirect costs to 15% or less of the award given by the NIH. This was the initial intention of the executive order, was to reduce the amount spent on these indirect costs. As a comparison, at Duke University, they are awarded about $863 million in federal government funding over the fiscal year 2024. Their research budget in its entirety is $1.3 billion. So they are using these funds given by NIH quite a bit for indirect costs, and we'll talk about that in a little bit. But on average, Duke incurs about 61% of the award for indirect costs. And based on that amount, we're looking about at a $580 million risk of loss for research funding at Duke University. Since that time, there have been multiple lawsuits filed against NIH and the current administration over these NIH changes. Since that time, most of the funding has just been frozen. Since now these are tied up in the courts, all the funding has been cut off and it's now stuck in the courts and frozen. That's causing harm to research. Research that was started has to stop. The funding isn't there to continue that, so the research data is going to be lost to time. Animals that have been utilized for research are having to be euthanized because there's no funding to take care of them or to continue on with the research. And layoffs are starting to happen for research staff that are all part of that indirect cost related to being able to perform that research. Organizations have stopped building onto research studies that are now defunct. They're stopping building of actual labs that were being built for projected projects. And many institutions are even decreasing their PhD programs because they can't afford the funding for those PhD students to assist with studies that are already occurring at that university. So why this big to-do over indirect costs? Why are indirect costs so high? What we have to know is that the indirect costs are anything that are not related directly to the salaries and stipends for the researchers and the grad students themselves, or project-specific supplies. So things like massive refrigerators, things like centrifuges that are shared, or microscopes that are shared, or computer systems and secure data storage, radiation equipment and protection. All of those things are indirect costs, and those can be huge amounts of money. If we're talking about research facilities in terms of the libraries, just the utilities and the personnel to maintain the buildings and keep things operating, administrative costs that are tied into the regulation and maintaining of records around these studies are all indirect costs, and that accounts for the majority of these research costs and a lot of the high-level research that's being done at these universities. So who is being hit the most by these? There are institutions that are maintaining their position on diversity, equity, and inclusion, and those schools have had their funding frozen, and it's going even beyond some of the NIH funding things. Vaccine-related research has been frozen. Also affected is research from cancer, Alzheimer's, diabetes, even general public health research is being frozen and harmed due to the large amounts of funding that have been reduced, as some researchers will work on multiple projects, and that's what supports their staff, their salaries, and the ability to have the labs available to do these things. So it's not affecting just one area of the country. This is across the country. So 780 NIH grants have been terminated within the first months of the cuts, and these affect all across the country. The larger the circle, the more number of grants that have been terminated. And you can see up in the Northeast where a lot of that hardcore research in those large institutions that have been around for a very long time have been affected. California, Florida, Illinois, North Carolina, a lot of organizations, universities, colleges are being affected by this. And it's not just public or even private institutions that are affected. So public is the majority. 94 of those organizations have had grants terminated. Private institutions of higher education, Harvard, Duke, Columbia, those have also had those cut. But also hospitals and medical centers that are involved in research have NIH grants, and those are being cut. And that may support other roles and aspects within the hospital. Nonprofit organizations that do research have had some of theirs cut, and that's affecting the status and the sustainability of that very nonprofit organization. So this is a little bit, just a dab into what this has encountered for us in terms of these NIH grants and the freezing of these funds. We'll see where this goes as the courts make decisions, but this is having widespread effect on healthcare across the country, and it will continue to affect us for quite some time, even if the courts rule and then there's appeals. We're looking at multiple years of uncertainty around these NIH grants and further research. If you have questions, please feel free to contact either myself, my information is attached, or the AAOE Advocacy Council.